Hello, good day, everyone. This is your nurse Edwin again. This time I have a suggestion from one of my followers. She's asking me if I can expound a little bit about respiratory system. As we all know, respiratory system delivers oxygen to the bloodstream and removes excess carbon dioxide from the body. So it actually has a lot of structures. So the structures of respiratory system include the airways and lungs, the bony thorax, and respiratory muscles. So the airways of the respiratory system consist of two parts, the upper and then the lower airways. The two lungs are parts of the lower airway, and it actually shares space in the thoracic cavity with the heart and great vessels, the trachea, esophagus, and bronchi. The upper airway warms, filters, and humidifies inhaled air, and then sends it to the lower airway. It contains the structures that enable a person to make sounds. Upper airway structures include the nasopharynx, which is the nose, the oropharynx, which is also coming from the mouth, the laryngopharynx, and then the larynx. The larynx, to understand more about the larynx, which is actually located at the top of the trachea, it actually houses the vocal cords. It actually the transition point between the upper and lower airways. The epiglottis, on the other hand, is a flap of tissue that closes over the top of the larynx when patient swallows. This particular organ protects the patient from aspirating food and fluid into the lower airways. The lower airway includes the trachea, the bronchi, and then the lungs. The lower airway begins with the trachea, which divides at the carina to form the right and then the left mainstem bronchi of the lungs. The right bronchus is actually shorter, wider, and more vertical than the left. The right lung is larger also. In fact, it has three lobes, the upper, the middle, and then the lower lobes. The left is smaller and it has only two lobes, which is the upper and then the lower lobe. Each lung is actually wrapped in a lining called visceral flora, and all areas of the thoracic cavity that come in contact with the lungs are lined with parietal flora. It is actually a small amount of pleural fluid fills the area between the two layers of the flora, because this will allow the layers to slide smoothly over each other as the chest expands and contracts. The parietal flora contain also nerve endings that transmit pain signals when inflammation occurs. So how the circulation happens? Remember our hemodynamics of the heart? Usually, the oxygen depleted blood enters the lungs from the pulmonary artery of the right ventricle. Then it flows through the main pulmonary arteries into the smaller vessels of the pleural cavities, and in the main bronchi through the arterioles, and eventually to the capillary networks in the alveoli. The alveoli, guys, are the gas exchange units of the lungs. Gas exchange meaning the oxygen and carbon dioxide diffusion takes place in the alveoli. So after passing through the pulmonary capillaries, oxygenated blood flows through progressively larger vessels and enters the pulmonary veins and finally flows into the left atrium. So basically, this is the hemodynamics of the heart, where the unoxygenated blood enters to the pulmonary artery, goes to the lungs, something like that. Okay, now, the bony thorax, on the other hand, is composed of clavicles, sternum, scapula, 12 sets of ribs, and 12 thoracic vertebrae. Let's discuss about the ribs. The ribs actually are made of bone and cartilage, and it allows the chest to expand and contract during each breath. The respiratory muscles this time, when we used for breathing, are the diaphragm and then the external intercostal muscles. The muscles contract when the patient inhales and relax when the patient exhales. The respiratory center in the medulla initiated each breath by sending messages over the phrenic nerve to the primary respiratory muscles. So impulses from this nerve or from this phrenic nerve regulate the rate and then the depth of breathing depending on the carbon dioxide and the pH levels in their cerebrospinal fluid. Now, here's how other muscles assist in breathing. The inspiratory muscle elevate the scapula, the clavicle, sternum, and then the upper ribs. This expands the front to back diameter of the chest when use of the diaphragm and intercostal muscle is not effective. Expiration, on the other hand, occurs when the diaphragm and external intercostal muscle relax. So if the patient has an airway obstruction, for example, he may also use abdominal muscle and internal intercostal muscle to exhale. Now, how can we say if there is an effective respiration? Okay, effective respiration, guys, requires gas exchange in the lungs, which is also called as the external respiration, and also in the tissue, which is the internal respiration. There are three external respiration processes that needed to maintain adequate oxygenation and acid-base balance. These are ventilation, number one, which is the gas distribution into and out of the pulmonary airways. Second is the pulmonary perfusion, which the blood flow from the right side of the heart through the pulmonary circulation and into the left side of the heart. And then the last one is diffusion, which is gas movement from an area of greater to lesser concentration through a semi-permeable membrane. Now, let's go a little, how are we going to assess if we have patients who have some respiratory issues? So, okay, let's go to respiratory assessment. Respiratory assessment, guys, is a critical nursing responsibility. So, conduct a thorough assessment to detect both obvious and subtle respiratory changes. So, how are you going to do it? First is build your patient's history by asking a short, open-ended questions. Conduct the interview in several short sessions if you have to, depending on the severity of your patient's condition. So also his or her family member that they may be able to provide you information if your patient can't provide you information. So respiratory disorders may be caused or exacerbated by number one, obesity, smoking, and workplace conditions. So be sure to ask about the conditions as well, these particular conditions as well, if you notice that this patient has this following conditions. Now, begin by asking why your patient is seeking care in the hospital or in the facility, because many respiratory disorders are chronic. So ask how the patient's latest acute episode compares with the previous episodes, and what relief measures are helpful and not helpful. So, patients with respiratory disorders commonly would report such complaints as number one, shortness of breath, cough, sputum production, wheezing, chest pain, and sleep disturbance. So, that's all for now. On my next topic, we will discuss lengthy about how are we going to assess as far as respiratory is concerned. How should be done, very easy and very systematic. So that's all for now. Again, this is your nurse Edwin. So make sure to please subscribe and click the notification bell button for more nursing updates. Thank you and